Good evening and welcome, folks and family. Welcome back to Parent Power Hour, the summer edition. So you know that we are bouncing between weeks here on our show. I'm so honored, blessed, and jovial that you are joining us as parents and stakeholders, getting ready for the fall, getting ready for the much anticipated school year this year, joined today by two esteemed doctors, Dr. Elliot and Dr. Beaudry. And of course, we have the face of the franchise, Mr. Tyrone Barnwell. And today we're going to ask a lot of questions of these doctors today about the vaccine, try to get some information, some understanding, and maybe help to release some stressors for our parents and our students who are headed back full-time in the fall. But before we do that, Tyrone, as always, I'm really interested, Tyrone, to hear what our guests have to say because they did not tip their hand in this. I was hoping to hear something, Tyrone. They didn't say anything. So the question for us to get started is, what is your favorite summertime meal? Your favorite summertime meal. We're going to start, ladies, first. Dr. Beaudry, what say you?
Yeah, so I would have to say anything with corn on the cob. I love corn on the cob. My family growing up was huge into it, and we would literally take like multiple pieces of corn on the cob and compare each piece and like discuss them. It would be like, well, this piece was really sweet and the kernels were nice and crispy, but this other one, that one like had a really nice bite to it. So that was what we did. So I still have this nostalgic connection to it. And I also just think it's delicious.
Okay, now I've never heard of comparing each kernel when partaking, but let me ask you this, Dr. Beaudry. Did you all have particular recipes with corn on the cob, or was it just pretty much butter, or how did you all do it?
We just had it totally bare. My mom would boil them, and then we would just have them without any sort of butter or salt or anything. And that way you kind of get just the corn. My husband grew up putting butter on it. And so now I've gotten into that a little bit and putting on some Old Bay since I'm living in Maryland now. But yeah, so I love it, anyway, grilled, boiled, butter, Old Bay, it's all good.
Wonderful. Thank you for sharing that. That is very unique. Never heard of that before. Comparing just the essence of the corn. Dr. Elliot, how about you, sir?
Yeah, I was thinking about this, and I think that I really love a good fruit salad in the summer. And I like the different variations of like what people put in the fruit salad. Now, obviously not too crazy, but I love to have a fruit salad that's kind of surprising. Like, oh, we put strawberries and blueberries in this one, okay. Or this one has, honeydew and watermelon, so I really love that in the summer. I look forward to that.
Excellent fruit combinations with the salad. We normally save our esteemed co-host, Mr. Tyrone Barnwell, for last because he gets our family and all the different folks on his platforms coming in. So I will go next. So my wife has made this, this is the second time I had it just before the show, this pesto sauce that she drizzles over chicken, just light and delicious and perfect. So I'm a newfound pesto fan.
Just light, delicious, and perfect. Like that.
That's it.
Okay. All right. So first of all, welcome Dr. Elliot and Dr. Beaudry, William, and everyone who's watching. As always, you all, please put your comments and what's your best summer dish in the comments. We'll, of course, acknowledge some of those. Thank you for being here. Share the live, y'all. Comment and ask questions. You all have asked for this. We've wanted to get professionals here, so please come with your questions. I should be overwhelmed with questions today. Now, two minds. My favorite summer meal would probably, and I know it's like, it would probably be tuna fish. It's like quick, easy. It's just the quickest thing to, make, and it's good, satisfying. And that's the only time I really eat tuna fish.
It's in the summer.
is in the summer.
Okay, now, all right. So here's my question to you before we go on to what's really important here. So do you do it on toasted bread when you make a sandwich out of it?
That's the only way you can have tuna is on toast. Have to be lightly toasted. Like it have to be.
Okay.
Absolutely.
Then we can continue this program. Otherwise, there was going to be some issues. All right, family, thank you so much for tuning in. We're joined by Dr. Elliot and Dr. Beaudry, who are going to give us some information about the COVID vaccine. There's so much coming out in the public forum. It can make one's head spin. It could give one whiplash unfortunately, from the hierarchies of our government to our health community. There's a lot of questions. There are a lot of questions. And I think what we've talked about here on this show and with our wonderful parent participants is that there's been so many shifts for us. And Dr. Beaudry, you were mentioning that you're a parent as well. So many shifts within this last year that, outside of just the physical presence of COVID-19, the anxieties have taken on, symptoms of their own, I would say. So we're so glad to have you here. Can Dr. Beaudry, we'll start with you. Can you just give us basically how do vaccines work against diseases? We'll start with that.
Yeah, great. Thanks so much for having me. I'm really excited to be here. And just to give a little bit of background on myself, as William was mentioning, I am a parent. I'm a proud parent of 5 kids, 3 of whom are Baltimore City Public School attendees, and we're excited that they're hopefully going to go back to school in a couple of short weeks. And I'm also a pediatric infectious disease fellow. So I take care of patients when they come into the hospital and they have either infectious disease that they need we need to help them to treat, or they develop an infectious disease while they're admitted. And I've also done some COVID research. So to get to in terms of how vaccines work, so that's a great question. So there are several different types of vaccines that work in different ways, but the general idea behind a vaccine is that you give a vaccine to prevent an infectious disease before it happens, either by using a weakened germ or part of the germ, and that allows the immune system to be trained so that when it actually encounters the germ itself, it's able to effectively fight it off. And it's important to say that, it's a weakened germ or part of the germ so that it can actually cause disease, like the vaccine itself can't cause disease. In terms of COVID, probably the one that everybody has heard the most about is the mRNA vaccine, either Pfizer or Moderna. And so many of you, are probably wondering what in the world is mRNA. And I think that, it's one of those things that we hear it a lot, but just to clarify what that actually is. So many of you probably remember back from, your high school biology days that DNA is a genetic blueprint of almost all living things. And if you think about a blueprint, it's essentially the plan for how to make some sort of object. So if we think about like a blueprint for a toy, for example, you can't directly go from your sketch, from what you've like sketched out on a piece of paper to the object itself. So your sketch is like the DNA, right? It's your blueprint. And the object itself is like a protein that you're trying to make. The mRNA is an in-between step. So you have your initial sketch and you have to put it into some sort of form of code that the machine can sort of read so that the machine can make the toy or whatever it is, in our case, a protein. So the mRNA isn't DNA, but it's instructions that tell your cells how to make a portion of the virus so that your immune system can be trained. And that way it's prepped. And once it sees the actual virus, it's able to take care of it quite effectively. And so that you don't get, severe complications from it. For COVID, it's actually better at doing, the vaccine itself is better than doing it than being infected by the virus itself, amazingly.
Thank you, Dr. Beaudry. We definitely needed, I know I needed to hear the old high school roundup about DNA. Dr. Thomas, so moving from what vaccines are to their effectiveness, and this is, just, just to be honest, a lot of people are really questioning the effectiveness of the COVID-19 vaccine for various reasons. And of course, you hear about conspiracy, so forth and so on. But I would argue just regular, plain, everyday folks who want to have some knowledge about how these vaccines work based on the timeline that they were produced, based on news reports from legitimate sources that you hear. There's legitimate concern about this. And a lot of people, especially the people that are watching you all tonight, want to have professionals to help them get out of the weeds. And of course, a lot of this, unfortunately, has become political. And so can you just give us, in practical terms, how effective would you say that these vaccines are?
So I would say that they're very effective. So in terms of what we're looking at right now is having symptoms, hospitalization, and things like that. So what I would say is that it's very effective in that. So the CDC says that overall, these vaccines are 94 to 95% effective in preventing COVID-19 associated illness. So that is, I would say 19, I guess if I did the math right, check me on this. I guess 19 out of 20 would be the fraction. But 95% effective. So I would take those odds, but I would say sorry about that, about the noise.
Okay, so 95% effective right now. Is this with all of the vaccines that are on the market right now? Because depending on where you were, depending on your accessibility, and unfortunately in Baltimore City, you know this, Dr. Elliot, you've talked about a little bit about equity. People were subject to get whatever they could get at the particular time. And we've gone from vaccinations now to discussions about boosters. So is that 95% effective rate across all three current vaccination manufacturers?
So Dr. Beaudry, please, jump in. But from what I understand from Pfizer and Moderna, the quotes that I have seen is 94 to 95% effective. For the Johnson & Johnson vaccine, I'd have to go take a look at the data again. But I think Dr. Beaudry would probably know that information.
Yeah, so that's a great question. So in terms of the Pfizer and Moderna, I really consider them almost interchangeable in terms of there are very slight differences. They use the same technology, but in terms of their effectiveness, they're very, very similar. In terms of how effective they are, like Dr. Elliot was saying, there's different ways of thinking about it. So in terms of symptoms, the initial study showed somewhere between 90 to 95% effective in reducing your chances of getting sick with COVID at all, and more than 95%. I'm going to start talking a little bit about the Delta variant because I know that that's been something that has been in the news a lot, and certainly something that we've all been keeping a really close eye on within my field. And it looks like there is a little bit of a reduction in how effective it is for the Delta variant, but that it still is very effective. In terms of getting sick from COVID, it looks like it's somewhere in the probably 80-something% range based on some studies that they've done in England and also in Israel. But it's very, very protective, more than 90% protective against hospitalizations and death. And right now, in terms of, when we look at hospitalizations, I think that the numbers I'm seeing is somewhere above 95% of those who are hospitalized or dying of COVID are people who are unvaccinated. So it's quite protective. In terms of a J&J vaccine, I'd have to look up the exact numbers. In terms of how protective it was against actual infection, it was a little bit less, I think somewhere in that 70 to 80% range, if I'm not mistaken, for the initial studies, but was quite protective, more than 90% protective against, hospitalization and death. And I think that, in terms of information about how well the J&J vaccine works against Delta, a lot of that information is still sort of coming out because, as you might know, most of the people who are vaccinated received the Pfizer or the Moderna vaccines. And that's also what was primarily used in some of the countries that vaccinated quite quickly. So for example, Israel. So that's where a lot of our information about Delta has come from. So I think that we're still, I think that there's some reports that it's probably a little bit less effective against the Delta variant, but we're not sure exactly how much yet, just because we're still waiting for some of that information to come out.
Thank you. And just before we go to Tyrone, Dr. Beaudry, you mentioned Israel. Israel was on the forefront of the trials, of the testing, and also with schooling. Really interesting. When they attempted school, they had to shut down early on. I would be curious, really be watching to see what Israel does this time around with school-age children, and if they're able to effectively stay back in school. But we'll circle back around to that, Dr. Beaudry. Tyrone, is there anything from our esteemed parents?
Absolutely. Y'all continue to share the live, everyone. I'm actually surprised that the numbers are here. I was expecting for us to be booming because we had so many questions, but those who are here, share the live. Questions, I want to acknowledge a couple of things really quick. Just some folks because we said we actually thought there are a couple of foods that we have for the summer is salads, pizza, and of course steamed crabs, right? In Baltimore, can't go without them, right? Steamed crabs. I should have said that. You got my thing. Anyway, couple of questions actually. One I want to get to first. I'll ask Jessica's and then I'll come to your question, Chris. And that is, should I worry about my 10-year-old since he is unable to be vaccinated and doesn't always keep his mask over his nose unless he is constantly reminded?
Thomas, Dr. Elliot, do you want to take this one or do you want me to take this one?
Sure, I could take it. So it sounds like, so a 10-year-old, I think that would probably be developmentally appropriate. Trying to keep a mask on a 10-year-old's face is probably kind of difficult, especially with them running around and everything like that. So what I would say is that if we think about things that can mitigate or decrease the spread of COVID-19 and prevent him from getting infected, yes, masking will be great. I think another thing that we would recommend, though, also is social distancing, especially when unmasked, but also when masking as well. I know it can be very difficult to keep that mask on a 10-year-old. I would just keep up the good fight with that. I obviously wouldn't make it a whole screaming match. But I think that it would be, in terms of worrying about him, I think that if we're talking about that, I would say that I guess there is a concern about him contracting COVID without his mask on. However, if you're doing other mitigation strategies, you can also decrease that risk too in terms of social distancing and things. Jeanette, did you want to comment on that too?
Yeah, this is such a great question because this is the question that all of us are facing as we think about sending our school-age children back to school in the fall. And so I think your question is a really great one. Our kids who are under 12 years old can't get vaccinated yet. And so by definition, none of them have the vaccine yet. And I think, it's been something that I've been thinking about a lot as I think about, sending my kids back. I have a almost 10-year-old as well. And I think part of what Dr. Elliot is saying is, we think about when we think about protection against COVID, it's not like a one thing you do this and you're protected 100%. We know even with the vaccine, it's 90-some% effective. And so the more things that you sort of layer on to protect yourself, the safer it'll be. And so I think, thinking about, for example, school, I think a lot of our children have been out of school or have not been in full day school for a long time now, for over a year. And so for many of them, it's really important that they get back into school full time. But how can we do that safely? And I think, encouraging encouraging kids to go back to school, but to do so with masks as much as possible. And it sounds like it's been a little bit of a struggle in keeping the mask on. So, things like practicing, giving your son a way to sort of remind himself to keep on his mask. Maybe when he's at school, that means having a little, thing that he has on his desk, a little sign that he has to remind himself to pull up his mask. I do think that, in situations where there are a lot of children and they're all doing the same thing, it becomes a lot easier for each child to be able to do it. So I was quite happy to see that Baltimore County had initially said that they were not going to require masking, and that it was going to be optional. But now, in light of the new CDC recommendations, they're requiring everybody to mask, which I think is a good move, because that makes it easier for each kid to remember to wear their mask if their classmates are all doing the same thing. So I think, caution, not that, I think that we've been doing this for a long time now. And so I think thinking about that risk benefit, it's important that kids, are able to socialize safely, are able to learn in person as much as possible, but to do it in the safest way possible.
Tyrone, let me just break in real quick, because Dr. Elliot triggered something that I was going to ask later, but I'll ask it now. Dr. Elliot, the CDC said in the spring, I don't recall the month, that the social distancing aspect of education can go from 6 feet to 3 feet. We have seen this year, being in the hybrid situation, Dr. Beaudry, you may be privy to this as well, that a lot of the students, just because they're kids, gravitate closer to one another than that, even 3 feet. So then that's 6 feet. So when the CDC says it's okay for kids to be 3 feet, and if you're talking about full classroom sizes in Baltimore City, you're talking about 30, upwards to 35 scholars in the classroom, including the teacher and aides and anyone else. Why or how could the CDC take away that mitigation effort? Because I agree with both of you. The vaccine is one thing, but you also need other mitigation efforts to thwart this. So what are your thoughts on that, Dr. Elliot, about that distancing piece no longer really being pushed?
Yeah, so from what I understood at the time, and I have to go back and look at it, I think that was under the understanding that, or the, I guess, hypothesis that that the spread of COVID-19 in children, given how do I explain that? Given how far they can cough and sneeze and all those types of things, that could be reduced. Now, I think that what we have seen in schools is an amazing effort to try to put some of those social distance things into practice in terms of like plexiglass between students, making sure that they are socially distant in line and things like that. That's what I have seen personally. I'm not a parent, and so I probably need Dr. Beaudry to speak more about what she's seen in person, but at least what I've seen in terms of other parents that I'm friends with are telling me about like how they are doing this, is trying to make sure that it's socially distant as possible. Now, in terms of the 6 feet versus the 3 feet part, what I also have seen too is making sure that we are talking about the right age groups. And I think Dr. Beaudry, you probably could comment on this more in terms of where we have seen like the 6 feet versus 3 feet decrease to 3 feet. But I think that trying to make sure that all those other mitigation efforts are in fact in the schools, I think is an important piece of that.
Yeah, so I totally agree with Dr. Elliot. And we know that, the distance is sort of a spectrum. So it's not like if you're 6 feet apart, you're totally safe. And then if you, move 5.5 feet, now you're at risk. Or if you move back like 6.5 feet, now you're like totally safe. So it's not an on-off thing. It's more of like the closer you are, the higher the chances are that you're potentially going to get infected if that other person is infected. And so the farther away is better. But I think that there is definitely a balancing between the number of children you could fit into a space if you have to do 6 feet versus 3 feet. And there were studies that were done, in over the course of this last year, where they showed if you, and the exact details of the study are, I can go through those, but essentially they looked at schools that didn't require distancing. They said you could go down to 3 feet of distancing, and compared them to schools that said you absolutely need to stay 6 feet apart. And what they showed was that even for these districts that said you can go as close as 3 feet, that they were still able to safely open last year. And so that's where that sort of recommendation came from. And certainly I think that my preference would always be that we would have, the farthest distance from each of the kids as possible, and as much outdoor, time as possible rather than indoors, and that everybody would wear a mask. But I think that, there's also sort of the recognition that we're in the real world, and that, there are things like lunch that everybody is going to need to take off their mask. The weather is not always going to be nice. So kids can't always be outside all of the time. It's going to be cold or raining or snowing or whatever it is. And then lastly, I think that there are physical constraints in terms of the space. And I think 3 feet would sort of be a minimum, but as much space as possible is always, the best. That said, I think that, the studies are, especially if kids are masked, I feel more comfortable with the 3 feet. There haven't been any great studies specifically looking at, we're going to have a classroom and they're all going to be 3 feet apart. Then we're going to have this classroom that's 6 feet apart, and we're going to compare the two. It's really been studies that look backwards and say, this is what the district decided on. I hope that's helpful.
Thank you. Tyrone, forgive me for butting in, but I had to get that question.
No problem, sir. Butt in. This is what we do. Get it in. But to get back, it was posted. I do just want to quick. I'm gonna get right to your questions, Chris, right now. But just because we talked about it, we have pinned the insert from the CDC site that says that the J&J Janssen COVID-19 was 66.3% effective in clinical trials. So that's there. It's pinned. You can go there and click if you want to read the whole insert. I'm not reading it all to y'all. But the question that we have, one of them, is what do you have to say, excuse me, to those who believe that the mRNA vaccine can change genetic code of DNA? Yeah,
so I can take that one. So this is a great question, and I think this is something that has been a concern, something that comes up a lot. So, going back to what we were chatting about in terms of how this vaccine, what the mRNA is. So if you remember, if we go back to what that illustration was, you have your DNA, which is the genetic blueprint that that tells your body, essentially codes for your entire body. And then there's the protein, which is like the end result. So the protein is like sort of the building blocks that makes up all of our cells. So your heart has proteins that make that are in a cell, and then they all kind of gather together to form tissues in your body. So the mRNA is an in-between step. So the DNA is like, when you draw a sketch on a piece of paper for a toy that you're trying to make, and the toy is your protein. But you can't really go straight from that sketch to the protein. And so the mRNA is you putting it into the, computerizing it, those instructions, so that it can make that toy, the protein. So in terms of the mRNA, it's not actually DNA. So it's a separate, it's also a plan, but it's a different type of, it's not interchangeable. And the mRNA, when they give the vaccine, it can't actually go into the center part of a cell where your DNA is held. So your DNA is held in something called the nucleus of a cell, and the mRNA doesn't go into the nucleus at all. And so it's not able to enter the space where your DNA is sitting, and so it's not able to change the code. And so I think, it's a very understandable, concern, but I think that the fact that it never gets into that space tells you that it's not able to change your genetic code. I think the other thing that's important to know about mRNA is that, as I mentioned, it's sort of that in-between stage between the blueprint, the DNA that's always there, and the toy itself, the protein. But the computerized sort of version of that plan is only there for as long as it takes to make that toy, and then it's destroyed. So it's in your body for a very short amount of time, just long enough to make that protein. And then, all of our mRNA that we have in our body normally is, taken away within minutes to hours. And so it's not hanging around for a long period of time.
Thank you so much for that. I definitely hope that X you out. You all continue to ask questions and make comments. Another one is, what are the chances of side effects from the vaccine further down the line, coming from someone who hasn't been vaccinated yet and has concerns?
Yeah, that's also a really great question. And I think one that, I think is on the minds of a lot of people as well, right? Because I totally hear this is a relatively new vaccine. And there's concern that, this process was sped up, that, that maybe this, the proper steps weren't taken to make sure that this is really safe. So just to back up a little bit, in terms of how, they evaluate these vaccines, it goes through a process where they go through clinical trials, and there's different phases where they have, a really small group of people that they test the vaccine in to make sure that it's safe. Then they add in a few more people and test it in them to make sure it's still safe. And then that's when the third phase is where they do a bigger trial with a large number of people. And that trial is the first one that they're really looking to see, is there a benefit in terms of protecting you against COVID? And normally that process takes a long period of time, because as you can imagine, they have to find people to enroll. They need to, get all the people, all the parts, sort of the logistical parts, in order to vaccinate these people, to do the studies. And then they need to analyze their data usually before they go on with that next phase, because they're really expensive. In the case of COVID, all of those steps were still done with the same amounts of time that they normally would use for each of those actual phases. But what they took away was the period of time where they're analyzing their data before they move on to their next phase. And so they had already lined up, all the people to do the next phase before they finished analyzing the data. And that was to basically be able to shorten the time frame without actually decreasing the amount of, studying that they're doing. They're just decreasing that sort of administrative time. And normally they don't do that because it's really expensive to do that, to like sort of, you don't want to scale up if it turns out that this vaccine isn't going to be safe. But they did that in the case of COVID because, it was such a pressing concern at the time. In terms of side effects, most of the side effects, so I want to say, the COVID vaccine overall is quite safe. There are some side effects that, are associated with it that I think are important to acknowledge and to talk about. But the fact that we know about these side effects, especially the more concerning ones, I think is indication that the CDC and the FDA have been doing their job in making sure, keeping track of the side effects that people are having, even as they've expanded it. So now, over 50% of adults in America have gotten this vaccine. So they're still keeping track to make sure that there's nothing else that sort of pops up, especially, the more rare side effects. The most common side effects that you can have are things like fever, not feeling well for a couple, for a day or so, feeling kind of tired, sort of muscle aches. I remember my arm swelled up and it felt really, really sore for a good, 8 hours or so. I was like, oh. So I think those are the most sort of common side effects, especially for the mRNA vaccines, that second dose. And that's because your immune system is sort of, we're trying to train up your immune system. And so it gets all, it gets all revved up because it sees something that it wants to make sure that it can attack if it ever sees it again. And so your immune system causes the fever and the sore arm and the swelling. And so that's an indication that the vaccine is doing what it's supposed to do. Most of when we look at all vaccines, most of the side effects that you're going to have or bad events that you're going to have are going to happen within a week or two. And certainly within a month to 2 months, pretty much every single vaccine we've ever looked at, usually the side effects that you're going to see are within that time frame. The big exception for that is dengue virus, which we don't really see very much in the United States but it has something that, you can see it many, many years after, but that's, a outlier in terms of like, vaccines. And it's not even something we vaccinate for even worry about here in the United States. In terms of the more severe side effects that, I think are important to acknowledge. So there's, for the J&J, there was concern about clots, especially for young women. And it does look like that is a concern, that you're more likely to have certain types of clots. And, these clots do sometimes happen in women or people, regardless of the vaccination, but you're more likely to have that happen to you after the vaccine. And so in young women, oftentimes, they're not seeing that with the Pfizer or the Moderna vaccines. And so they can safely get those without that increased risk. The other big thing that we've seen is myocarditis, which is just a big word for heart inflammation. And so we've seen that, especially in sort of younger adults who are males. And so, essentially after the vaccine, especially after that second dose, there can be heart inflammation. The good thing is we also see this in young people and oftentimes after a virus. And in many cases, especially after a virus, it can be quite dangerous. The good thing is, so far, in terms of what we've seen, most of these people who develop the myocarditis, the heart inflammation after the vaccine, actually do very well. And so they recover fully. They do require hospitalization, but typically for a few days, and they monitor them, they give them some treatment, and then people have been able to leave the hospital without incident. When you look at, and I think that, thinking about the vaccine, like I'm telling you that there's risks to the vaccine. I think the other thing to say is that, COVID is relatively new too. We've only known about COVID for less than 2 years. And so I worry about the long-term effects of COVID because we know what the short-term effects of COVID and the vaccine are. And what we know about the short-term effects of COVID is that it's bad. Hopefully you don't get a severe case, but there are many people who get hospitalized or die from COVID. And if you're fortunate and don't have those things happen, we also know that there's something called long COVID. And that's something that we've only appreciated until once we had a little more information. And so my fear is that as we kind of learn more and more about COVID, there's going to be more, downstream effects that we find out about. And I think that it's quite likely that there are going to be long-reaching effects of COVID. We've already kind of seen that. I think the other thing to note is that, we initially thought that children weren't really affected by COVID. We were like, oh, they all have mild illness. And it wasn't until we had several months of the pandemic when we recognized that there could be inflammation in kids' bodies after COVID. You might have heard of MISC, or multi-system inflammatory syndrome in children. And that can make children quite ill. Both Dr. Elliot and I have taken care of many children with this in the hospital. And those children oftentimes require going to our ICU and require medications to help their blood pressures and can be quite sick. So I think that, there are many long-term effects of the virus. And so far, I think that we are seeing that there are some side effects that we're watching for the vaccine. But when you compare the two, I think that the benefit from the vaccine far outweighs the risks. I don't know if Dr. Elliot wants to add anything to that.
Yeah, no, I totally agree, Dr. Beaudry. I think that this MISC was something that hit our hospital kind of like a storm. I very much remember that. And I think it, like you said, there are so many things that we were finding out about COVID, COVID infection, acute COVID infection that, and I think we're going to keep learning, like you said, about long COVID. I know that the New York Times is just talking about how long COVID is thought to be affecting children now. I haven't seen all the studies from that, but I know that was a headline, I think this morning or yesterday morning. And so I think that we're going to keep learning that COVID is bad news. And I think that overall, I always say to parents when I'm talking to them about any vaccine, that it's risk benefit, right? What are the risks of getting the vaccine versus the benefits of getting the vaccine. And what I would say is the benefit, you know, when I was trying to make this decision for myself, right? And given how, you know, I know we talk about this a lot, but given how the marginalized community, such as like the Black and Brown community, has gotten the short end of the stick historically around medications, about medicine, especially when you talk about government. But I also looked at how COVID-19 was completely ravaging Black and Brown communities of Baltimore. And for me, the risk benefit of me trying to protect myself, trying to protect my community, I think a lot about, so in my fellowship, I think a lot about what interventions should have been done. What interventions should people have access to? And when I think about that, I think about the COVID vaccine and the fact that in these communities that are being very hit hard by COVID, that access to vaccine is a life-saving procedure.
Thank you both for that. I will jump in. I know there's some other things, William, you need to get you, so I'll just ask two more, because unfortunately we went out of time, and I know this was going to be like, you know, one of those shows where questions were going to come, and now numbers are coming. Like, I'm getting like 4 different groups of things coming. I want to come and now this this conversation makes sense when only discussing COVID, but going back to school for teachers and scholars also means flu season. Any thoughts around that?
Yeah, such a great question. So I think, you know, we always worry about COVID. We're worried about COVID. We're also worried about flu. And many of you may remember that this last year, we were really worried that there was going to be bad COVID and flu at the same time. Usually, you know, the winter is sort of the season that we see all these respiratory illnesses like COVID and flu. But fortunately, this last year, we really didn't see that much. And the reason is, I think, because, you know, people were distancing and wearing masks. And what we sort of saw was that when people distance and wear masks, that many of these respiratory illnesses that people get sick from are much less common. And what we saw was that not with flu, but with something else called RSV, which is a virus that causes little babies, especially, to have difficulty breathing and oftentimes require hospitalization, that those rates were really low during the winter time when we normally are hospitals bursting at the seams with kids with RSV, but that then in the spring, when things were kind of loosened a little bit and people were going out more and interacting more, that we actually saw a spike in our cases in the hospital. And so that's something that I am worried about, especially since people are going more and more back to sort of normal life. And I think it's a good reason to think about, you know, being careful with, you know, your interactions, even if you have the vaccine, to make sure that you're masking and when you're indoors and sort of thinking thoughtfully about, you know, how much time you're doing things like in person. You know, I think that some people talk about sort of your budget of risk. So everybody has a different, you know, sort of risk tolerance. Some people feel more comfortable with tolerating, you know, they're like, I recognize that these things might put me at increased risk, but I'm okay with that. But I think all of us have sort of an idea of how much risk we're willing to take and sort of budgeting that out and saying, you know, it's really important to me that my kid goes back to school. You know, they really didn't do well with virtual learning this last year. So I'm going to send them and prioritize that. I'm going to have them mask, but that to me is important. That may mean that, you know, I don't want to send them to another activity, or, you know, I'm going to, you know, choose not to do this indoor, you know, we're not going to, you know, go to the movies, or, you know, whatever it might be. Other people might make a different, you know, choice based on their own situation. But I think thinking about, you know, overall risk is really important. I think everybody, you know, I would encourage everybody, in addition to getting the COVID vaccine when available to them based on their age, I would also recommend that people get the flu vaccine this year because, you know, I think what we're seeing in southern states where there are lower rates of vaccination, where Delta is you know, transmitting quite frequently, is that those hospitals are starting to get overwhelmed. There was a video that sort of went viral of a physician at a hospital in Louisiana saying, you know, we are full and we don't have any more space right now. And you know, I think that Dr. Elliot and I, we went into this because we want to take care of people when they're sick. That is, you know, we want to prevent illness, and then we want to take care of you when you do get sick. But there's a limitation. There's only so many of us, and there are only so many nurses. There are only so many beds. And, you know, I think that if our wards are filled with COVID and flu, there's less beds for people who have appendicitis, who have cancer, who have a heart attack, who, you know, have all of these other things that may not be COVID, but they still need a hospital bed. And so I would really encourage people to as much as possible get vaccinated when you're able to.
All right, William, I'm so sorry. Listen, two more points. Y'all, I hope we can get y'all back at something. This is great. So one thing that I definitely want to also acknowledge is thank you both. You got to thank you from Chris. I will say that I'm almost sure that you've encouraged someone who's not vaccinated to now get vaccinated, and they feel comfortable with your responses. So I will acknowledge that publicly. That's one thing. And then just two other things quick. One point is, could either one of you, particularly you, Dr. Elliot, I'm going to ask you, it's come up a whole lot. A lot of people are just kind of leery and suspicious because there's been such a great push, particularly in the Black community, with these incentives to get vaccinated and make people not trust the process. So any thoughts on that from you, just because you particularly mentioned about the short end of the stick that Black people, you know, have? That's something. And then last question, and we'll go to William. Other folks will get to you. If either of you were in charge or headed the school or could encourage them, what would your thoughts be on how they should handle the lunchtime, you know, dealing with kids and being in there with returning it to in-person school?
So I'll start with the first one, and I'll try to answer fast. I know we don't have that much time left. All of this back in, so let me say this, right? Like, let me take off my doctor hat. As a Black person witnessing everything that has happened and all the changes and everything like that, I see it, right? Like, I see how this seems like, okay, y'all don't know what y'all doing, right? Y'all saying one thing, you mean another thing. Like, it's a lot of things that are happening. I get that, and I understand how, and at least for me too, like, it seemed like, okay, well, something is amiss. Something don't seem right. So let me just wait on this to try to figure out what's going to happen. Wait till y'all figure out, make up your minds and everything like that. What I would say to folks in Black and brown communities, right, is that a lot of this, the science overall is trying to figure out on the spot. Dr. Beaudry talked about how we accelerated how fast we can make a vaccine very safely, right? We also accelerated what equity looks like in a vaccine. We had specific, so the NIH, not many people know this, but the NIH made specific cohorts and groups to review the process and to review the data about how this vaccine was going to be approved, how they were going to do the studies and everything like that. And that included Black and Latinx physicians, nurses, and everything like that. And so that made me feel more comfortable. I'll just speak about myself. I think the other thing that made me more comfortable too is the fact that we, in an effort now, I think there's a double-edged sword, right? Like, we've learned a lot about how we make vaccines. The whole population has found out like how this actually happens and how much of an arduous process this is, right? And I think that is on display. What I would caution is that I don't want that to deter people, right, from the process of making the vaccine, okay? Because what I would say is that, like I said, there's been a lot of thought about how to make this the most equitable distribution. That's the reason why you're seeing, there's groups in Philadelphia, there's groups in Louisiana who are specifically making sure that there is access and equity and access to the vaccine. Because like I said before, in my mind, this is a life-saving procedure. And so that's why you're seeing that, right? Like, that's why you're seeing this push to be like, oh, like this, we recognize the fact that in a non-equitable world, Black and brown folks would not have access to the vaccine, and that's going to cause another disparity. So that's the reason why you're seeing that. So that's the way that I would answer that first question, is that, this has been almost scrutinizingly so, and I can give you some more references about that. So greaterthancovid.org is a great website that I would encourage people to check out, especially those from marginalized communities, because it's conversations for us by us, right? Conversations about the vaccine from Black and brown folks in the medical profession. And I think that that also kind of speaks to that, the fact that we have that kind of transparency, but also we have the transparency in creating and distributing the vaccine, I think is really important to me. So I would say that a lot of things, I know that, you know, this, like you said, and like I said before, shorten the stick is very much where we have gotten, right? But I think there's been so many efforts to try to make this equitable. And I trust that because it's been so clear that they have been trying to work on that.
Could you please, I'm sorry, could you please say that site again so that we can pin it for folks?
Yeah, yep. It's called Greater Than COVID. So just like it would be, .org. Okay.
Thank you. I think you're about to say something, Dr. Beaudry. I'm sorry.
Oh, no, I was just going to say, you know, Dr. Elliot and I were chatting the other day, and one thing that we were just chatting about was, you know, within our physician community, there was a lot of excitement about getting vaccinated, and pretty much every single doctor that I work with, that I know, you know, as far as I know, has gotten vaccinated. So I think, you know, there's definitely very understandable hesitation. And I think Dr. Elliot has done a really good, you know, job of discussing, you know, his own personal concerns. And I think, obviously, I personally don't come from that community, but think that we have done a disservice to, you know, Black and brown people in this country for our entire history. But I think the fact that there was such excitement within our group who actually have been following the studies carefully is another indication that, you know, we truly do think it's safe and effective.
Thank you so much. If either of you want to talk about the lunch, I mean, you know, like how you would do the cafeteria piece, and to attach to that, the last thing, y'all, and I'm not taking no more after this, we got to go. How can we encourage teenagers who think that COVID is not as real or as serious and not worried about the vaccine, that they actually need to get the vaccines? Coming from a parent who has a couple of teenagers who they're having to fight with to get to it.
Yeah. So I think for lunchtime, I think it's so challenging, right? Because we're taking away one of the biggest measures that you can do, especially in kids who can't be vaccinated yet, in order to prevent spread of COVID, right? There's no mask because you can't eat with a mask on. So I think if I were in charge, I think that I would prioritize as much as possible when the weather allows, when, you know, it's not like freezing or raining, that I would have them eat outside as much as possible if there is a suitable outdoor space. I know that, you know, we all live in the city, so there's differences in terms of what space is available for different schools. But if there were a safe space where they could, you know, a blacktop or whatever it is, I would send them out there because we know that, you know, outdoors is much safer than indoors. I think when you have to be indoors, I would encourage as much as possible you know, cohorting. So having a group of people who are, you know, as small as possible, as, you know, that group that's going to all unmask together and eat in a space. I worry about, you know, large, you know, you think about a cafeteria and there's like, you know, 100 to 200 kids in there at the same time. I worry a little bit about that, just because we know that there can be super spreader events, right? Where one person has it and they spread it to many, many people. So that makes me nervous. It would make me feel more comfortable if it was like, you know, your group of, you know, 25 kids or 30 kids who you spend all day with, that you're, you know, you're all going to mask together. You're all together anyways every day. If you could break that down into an even smaller group, that would be even better. But you know, I think we're real world, you know, you have to work with what you have there. And then I think I would make sure that everybody is staying as far away as possible and not moving around and not like, you know, getting up to like, you know, look at their friend's food or anything like that during that time. Everybody needs to sit in their spot. There should be minimal like talking, yelling, that kind of thing. Because we know, for example, you might have remembered at the very beginning, they did a study, and when they sang, there was, you know, you know, the particles sort of expel out of your mouth, and it can spread to many other people. So, you know, kind of minimizing the amount of, you know, yelling and loud talking during that time. But it's challenging. I mean, I think that that's the part that makes me the most nervous about school, for sure. And then, sorry, the last question was, can you remind me, Tyrone? I forget again.
Yes, how can we encourage teenagers to get it? And all right, if y'all have time, I'm sorry, they come in. Is there, so yeah, how do we encourage teenagers that are serious to get it? And also, is there any talk? So will there be a vaccine for those who are 12 and under?
Yeah, okay. Dr. Elliot, I'd love to hear your thoughts about teenagers as well. But my thought is that for teenagers, it's important to just, you know, have a real talk with them. They're old enough to understand how serious COVID is, and to talk about, you know, most of the people in the past who have gotten sick, really sick from COVID and have died have been, you know, older people. But now that a lot of those older people have been vaccinated, we're seeing more and more the percentage of people who are young and healthy who get COVID and get really sick from it. It's like shifting to more of the younger people, and saying, you know, it's a little bit like a seatbelt. You know, we want you to be as safe as possible, and it's one more thing to keep you safe. And saying, you know, it's my job as your parent to keep you safe. And this is something that, you know, we can do. It's you know, it involves, you know, just 2 shots and it'll keep you safe. And it allows them to do a lot more things, you know, things like, you know, when they go to school, they're at less, they're at lower risk. I think that maybe tying it to, like, you know, I would feel comfortable with you going to hang out with this other friend who's also getting vaccinated. If you get vaccinated, if you don't get vaccinated, I don't feel comfortable with that, because you're at risk for getting COVID. And, you know, your risk of getting really sick from COVID is much higher than it otherwise would be. So I think sort of tying it to that, you know, if you get the vaccine, these things become available to you. And actually, that's something that I talked about with my 5-year-old. She was like, you know, I'm scared of the shot when it's available. And I was like, well, you know, sweetie, like, this last year, you know, all the things that you've given up because of COVID. And I want you to be able to do those things again. And the vaccine is one of those ways that we can start to do some of those things again. But until you get vaccinated, like, we're not going to be able to do some of the indoor activities that you previously were able to do. I think that leads into that second question about, you know, what it looks like for kids under 12. So those studies are already underway. And initially, I was hoping that they were going to submit to the FDA. I think that Pfizer is a little bit ahead of Moderna and said that it was probably going to be September. I think there's more discussion now about the FDA asking for potentially more children in the studies, or looking at a longer period of time for 6 months or so. And I think their calculation was that kids seem to be less severely affected. They're always a little bit careful about kids because, you know, they always start, you know, if you're going to roll something out in terms of a new drug or vaccine or something like that in a population, you're going to start with the adults first, because kids are, you know, seen as more vulnerable. So you want to start with the adults, make sure it's safe, and then you sort of go down in age. So you saw that they did like the 12 years up in, you know, the adolescent category. And the next category is probably going to be school age from 5 to 11. And then after that, sort of the toddler preschool sort of age. So I'm a little bit disappointed that they pushed that time frame back, it seems. I think that with Delta and with, you know, I think that some of what they decide may depend on what happens over the next couple months, because I am quite concerned, especially in parts of the country where they're not requiring masking, they're not requiring even contacting parents if there's a positive COVID case, or telling them that you need to stay home, that there's going to be a spike in cases in kids, and that schools are going to become places where we see a lot of outbreaks in certain areas of our country. And so I think that if that happens, there may be a push that, you know, we need this vaccine sooner. In my mind, you know, I would sign up my kids right now. And I say that as a mom, that if the COVID vaccine were available, I think based on what I know, I would sign up my kid for it. I think that it's important to still follow, you know, and make sure that there are no, you know, big side effects like we were talking about. And as we learn more, there are going to be things that we learn. But so far in the study that they've done, they haven't stopped it, which tells me that they haven't seen anything that has made them really concerned that within the group that they've looked at so far, that there is, you know, they've seen serious side effects. Dr. Elliot, what are your thoughts about adolescents?
Man, I love the adolescent population. So overall, let me say that if they're listening right now, have your parents have conversations with you about COVID. So that's my overall takeaway of this whole thing, is that for a long time, we have not involved children in that because like there was really no discussion about vaccine, right? Like there was like, we are not even doing that yet. But now it's a real discussion. And if I know adolescents, they want to be involved in what decisions they make, right? They want to be involved 100%. And I think that having these real talk conversations with them, right? Just as you would anybody else, because they're eventually going to have the agency to make their own decisions, right? I always say, like, to parents in clinic, you have to equip your child with the decision-making skills in order to make their own decisions, because eventually they're not going to have you. It's so great to have you right now, but eventually they're not. And so I would say that please engage your kids in meaningful, honest discussions about COVID, right? And, you know, talk to them about the things that we've been talking about here, right? About like how this has affected certain communities. When we talk about adolescence, a lot of that emphasis also is on freedom, okay? And that's a real thing. Like everybody wants to do what they want to do. And I think that Dr. Beaudry brought up a great point in the fact that, like, you know, a conversation I would have to my, you know, hypothetical adolescent, because I don't have children. But if I had an adolescent, what I would say is that, you know, this vaccine is going to allow us to take one more step towards having the life that we had before all this COVID stuff happened, okay? Because COVID will live in places where people can get infected. And if you're not vaccinated, that means you are at much higher risk of getting infected, okay? And then that's gonna take you out of the game, or that's gonna take you out of your football game for 2 weeks, or that's gonna, you know, get you hospitalized or whatever, what have you. You gotta think about like risks and benefits and like what that will affect their immediate situation at the time. And because I think as a grown-ups, we always talk about hypotheticals, right? We think about like far, far down in like, you know, 20 years from now, but adolescents are making decisions right now. And so I think that involving them in that decision-making process is key today. I think that the other thing that I'll say too is that, like, this is going to be a learning process, right? We have been learning over the last year, and what a wild ride it has been. And I know that we are all like very exhausted, like, man, still masking. And you know what I mean? Like, I get it, you know, but I think that in the same way that we have been learning as grown-ups, adolescents should have the space to learn that as well. And, you know, getting back to that first question that we talked about the mask, right? Like, your 10-year-old needs to learn what it means. You know, what does the mask mean? Why are we putting it on and everything like that, right? Like, that is a learning process. It's the same way as the schools learning how to do lunch is a learning process. In the same way that that adolescents thinking about the vaccine and making decisions is a learning process. You know, and that us as physicians, parents, community members, and all that type of stuff, we are all learning together. So I just wanted to put that point out there as well.
And I love that answer, Dr. Elliot. The other thing I just want to also say is, you know, it's not on you to know every single thing about the COVID vaccine, you know, and I think that hopefully you have a pediatrician who you trust, who your adolescent trusts, and they can be a great source of information. And also, hopefully they're a person who, you know, your adolescent can have a real heart-to-heart about it with it. And to hear it sometimes from a non-parent can be helpful, especially as, you know, the person who is entrusted with, you know, making sure that they stay healthy. And so I think that, you know, making sure that you feel like they can be a resource to you. Really, that's, you know, Dr. Elliot and I love to talk to people about vaccines, love to answer questions, love to, you know, be able to have that discussion. That's why we're both here. And so I think, you know, making sure that you engage them and use them as a resource.
Look, we passed William out. Now you can have it. Sorry. Time is over. Before I do, thank y'all so much. The folks who are watching, you know, really thank y'all. And we've actually had a couple of people say that part 2. We're coming back for a part 2. We want y'all to come back. You know, there are more questions, everything. But thank you all for, you know, being here, taking the time out of your schedules. You know, coming here. You know, seriously, thank you. Elliot, I have to put this out on air because it was like, just kind of bothering me a little bit. I'm glad that without even having to come with a question that you did address some of the concerns that our viewers have within the community and the people who, who watch us and, who I know. So I'm grateful that just kind of like came up organically and, you were able to address some of those things. Again, I know there'll be more questions, but just, again, thank you all for your time. Y'all who have joined us, thank you all. Continue to share this live and get this information out there. I know a lot of the questions that I've gotten from people and we've heard over the last year and a half, a lot of those things were addressed today. So continue to share this live with those who weren't here, that are here. And yeah, William.
Dr. Elliot, Dr. Beaudry, thank you so much. As Tyrone said, join us Thursday at Tyrone's house. Maybe I can take over Tyrone's show on Thursday, as he certainly took over this show today. No, just playing. Thank you so much, parents, stakeholders, for all the wonderful questions for our doctors to answer. It was important for them to be here so they can answer your questions directly instead of it being filtered through various platforms. So this is wonderful. Again, Dr. Elliot, Dr. Beaudry, we really appreciate you all. We are way over time, folks. We will see you Thursday at Tyrone's house, if I have the schedule correct. Is that right, Tyrone?
No, we're back on Tyrone. We're back on our weekly schedule now, starting this week. Last week they're like, we ain't waiting no more. We cannot wait till school starts. So we are back every Thursday. And we only have one more bi-weekly week for this show off, and then we'll be back on weekly with Parent Power Hour as well. So y'all got us back.
Sounds good. So we'll see you all Thursday at Tyrone's house, virtually, of course, and then in 2 weeks back here. Thank you so much, family, and take care of yourself. Be at peace.